information gathering station. And we have the first case, which is splenectomy. Is Smith is a 9-year-old boy injured in the park. Park means dark, garden. Admitted for splenectomy, and the consent is signed by his father. His mother is angry. At this time, the child is in theater, and the both parents are separated or divorced, as the child father is alcoholic. Alcoholic means he drink a lot of alcohol. Patient hemoglobin was dropped from 9 to 8.1. His abdomen was rigid. He had a fracture in the lower left sided ribs. The situation was explained to his father, who signed the consent form. The consent was taken by another doctor, not by you. You met the patient mother in emergency department. Okay?
Okay.
All right. So you are standing and the mother is standing. Both you are standing. The mother came to angry and shouting to you. Okay? So
Okay.
what is your response? So the mother shouting and say, where is my baby? I need to see my baby.
نبدأ.
Yes, you can start.
Good afternoon. I am Dr. Mahmoud, one of the surgical team.
Yes.
I have been told that your child came today. What do you know? How far do you know about your son?
I don't know anything. I just receive a phone call, and they tell me that my son here in the hospital because he have an accident. Take me to my son. Usually the patient shouting, tell me to my son.
I really understand your situation. Let me explain to you what happened to your son.
No, the mother is still standing and say, take me to my son, doctor.
Can you please have a seat?
No,
and
I don't have a seat. I still standing, doctor. I am angry. I am standing. This is common. Happened in exam. She's standing.
Unfortunately, your son in the theater right now.
So take me to the theater to see him.
I'm really sorry to tell you that we can't go to the theater right now because the operation is running now.
Okay.
So can you have a seat and
all right.
I will explain all.
So now the patient is sit down because you tell her that your son in the theater now, so we don't allow to go. So she sit down. If you don't say and start to explain the situation, she's still standing and shouting. So it is important to tell her we unable to go there. Your son in the theater. Okay. So, all right. So you can start.
Your son came today, brought by his father.
Okay. So just tell me, doctor, what is the operation? You say in theater, what is the operation?
Your son has injured his spleen. Spleen is an organ in
no,
right
just tell me the name of operation, doctor.
Splenectomy.
So removal of spleen. Okay. So just tell me what happened to him.
Okay. Your son fall in the park and has a large bruise and rib fracture in the left side of his chest and tummy. After examination, and we found that he has what is called splenic haematoma. Splenic haematoma is a collection of the blood.
It is hematoma or hemorrhage?
Hemorrhage.
Yeah, so hematoma is another scenario. So this is hemorrhage. So who signs the consent, doctor?
My colleague, his father, but I'm not. I didn't present while his father signing the consent.
No, it is not important if you're present or not. But
his father.
Why you don't waiting me?
It's a good question to be asked, but unfortunately, during the situation, the consent is not necessary, and also his father is able to sign the consent.
I don't understand you, doctor. You mean it is the consent is not necessary, or he must be signed by his father.
The consent is not necessary because it is emergency situation. Also, his father signed the consent because
No, you just ask me. You just ask me.
I really sorry, but we can't wait to inform you about the situation of your son because the urgency of the situation of him.
You mean that I just need to understand, if this, suppose his father is not here, what happened?
We will go directly for the state for the
So
state.
you mean that whatever we are present or not present, so the consent is not necessary. It can be done by consent from other one. Okay.
Okay.
Or from the two consultant. All right. Okay. So who is doing the operation? He's an expert or not?
Of course, Mr. Man is doing the operation. He one of the best surgeons in the hospital.
Okay.
So,
By the way, in this script we don't mention Mr. Ben, but we usually we in some script we mention that Mr. Ben. Okay.
okay.
But by the way, you think that Mr. Man in English is the name? Is anyone can called Mr. Man, MANN?
لا, the surname.
Okay. No, it is not a true name, by the way. We just put an exam. We don't have
Okay.
some called man. Okay. All right. Okay. So what is spleen?
Spleen is an organ found in the left side of our tummy. It's
What does
help
tummy mean? You mean abdomen? Yes. It is.
abdomen.
Yes. All right. What is the function of it?
It's act as a defensive mechanism against some organisms.
Against what you mean by organism? You mean bacteria?
Bacteria, some bacteria.
How do you know the spleen is injured?
Because the patient clinically came with a rigid abdomen and has a significant drop of his hemoglobin, and there is a bruise on his left side.
What else? Is any investigation you did it to confirm?
According to the investigation, we did what is called focused assessment sonography for trauma. and انا مش عارف بقى هو هيبقى مكتوب في السيناريو هو عمل سي تي ولا لا ولا دي emergency نعمل
No, I
فاست.
will ask you later.
Okay.
Okay. All right. Okay. So what happened if not removed it?
It's called internal internal hemorrhage and may lead to this.
Oh, so why you don't remove the damaged part and leave the rest of the spleen?
We will try to do our best.
Doctor, relax. It is what you mean by remove part and leave the spleen. What I mean?
والله يا دكتور شيرين هو
What we call it? What we call it?
partial splenectomy.
Yes. Is this common done?
لا.
All right. Okay. So sometimes we can try, but usually partial splenectomy is not common procedure, so it's not common to be done. So usually you remove the spleen. Okay. Of course, in under CT we have 5 grades of the spleen. We don't ask you that. Grade 4 and 5 need splenectomy. All right. So back again. So what happened without a spleen?
Make the body vulnerable to infection. So
how to overcome this problem?
Vaccination and
what's the name of vaccine?
مش فاكر اسمه الصراحة. Moflus influenza.
It is triple vaccine or trivalent vaccine?
Triple vaccine. Okay.
Okay.
No,
so
antibiotics.
It is triple vaccine. Okay.
Okay.
Triple vaccine, which is pneumococcal, meningococcal, and H influenza.
Okay.
Oh, all right. So anything you added? So give him antibiotic, something like that.
Long-term antibiotics.
What you mean by long-term antibiotic?
Until the age of 16. Yeah, 16 years old.
Okay. All right. Okay. So in your hospital, they do that, doctor?
والله أنا ما
In your hospital, anyone work in surgery?
ما أعرفش
Anyone
هو
work in
كان
surgery?
ده كان
Okay.
زمان. هو دلوقتي يعني أنا كنت
Okay.
عايز أسأل حضرتك
So
سؤال بتاع
the usually
3 دوزز ولا
okay. No. Usually, if you give a patient here antibiotic, it is like any surgery. So it is a prophylaxis antibiotic, means that it is like 3 doses was pre-operative and after that and after that. In the past, many years ago, we gave till the patient become 25 long-term antibiotic, which is Ospin, which is type of penicillin. Before that or after that, they give it 2 years after attack. The least group, they give 9 months. But nowadays, if you have a vaccination, it is no need to give long-term antibiotic. Okay? If you read from all the book, of course, he mentions that long-term antibiotic or lifelong or something like that. But it's okay. All right. So last question, doctor. Is his father drinking at time of the consent taking? I know that you don't take the consent, but it is
Of course, we can't take a consent from a drunken man.
All right. So it is a good. So don't say I don't take the consent. The consent is taken by.
Okay.
By other people. So don't say it is my friend.
Okay.
Okay. Okay. All right. So after that, I think, of course, he's okay. So you know that we are divorced and we have a trouble. So I need because this is happened before. He have injured his knee. So I need to make a complaint or something like that. What shall I do?
It's totally your right, but I will direct you to the child protect consultant.
We don't have child protective consultant.
ما
It
أنا
can
مش
be
هقول
social
ليه.
service or child protective service or something like that. Okay. All right. So this is okay. So this is the same. Of course, the patient he take immunization can be repeated, but we don't give a what's called the lifelong antibiotic is an old policy. And of course, the doctor who takes the consent, which is not you, he don't take a consent from any person except he confirms that he is conscious and fully oriented and he is have a capacity to sign the consent. So don't tell the patient, I don't know because it's taken by my friend. So it is the hospital policy. Okay.
No.
All right. So are you Dr. Muhammad Ragab? Thank you, Dr. Muhammad. Anyone need to ask something before we start the second? Anyone
أنا
need to ask?
عايز أسأل يا دكتور شيرين معلش.
You can ask.
في الامتحان احنا يعني بنعمل تمثيلية وبنتفاعل ولا هيبقى الوضع ازاي يعني؟
You mean the actor? I don't know. Usually in Egypt, these become simple. But sometimes if they have an actor coming from Europe or from India, so usually they are actor. Actor mean actor, like he's make a small movies and he's practice acting so he can crying in front of you.
Okay.
So it is according to the situation. In other countries, like in Dubai, they have professional actor, like people play in TV and the small series and all this. Okay, so it's different from country to country. India also have professional country because cinema and movies is a big business in Bollywood and India. Okay, any other question before we start the second one?
دكتور
Okay, قول.
الحته بتاعت الكونسنت بس دي ما عرفتهاش.
Say again.
النقطه بتاعت الكونسنت ما فهمتهاش في الاول اللي
All
هو
right.
يعني
So suppose who signs if this patient come to you in hospital, who will sign the consent? In emergency situation. In emergency situation. Two consultant is no, don't wait the family. So even the family is present, it is just to inform him, but you don't need to sign a consent. If the patient came to you, suppose the patient come to the rupture or impending rupture of aortic aneurysm or trauma or spleen injury, you just explain to the family, but you don't need him to sign a consent.
تمام.
Because this is consent is done by 2 consultants.
وبتبلغ كده، يعني انا بقول ان في 2 consultant يعني هم اللي بيمضوا على الكونسنت لما هي بتسأل في الاول.
No, he asked about because he say is your father, her father, the baby father sign. So actually, even he's not present, we don't need his signature. Suppose I tell you, suppose the father refused to sign, what shall we do? We go to theater. We go to the theater and operate it. It is his signature is not mandatory, but because he's present, we tell him. Just explain to the family what are you going, but we don't need his signature or his consent, and also the mother. So whatever they are present or not present, if the patient come with injury of spleen, we remove the spleen. We don't wait anyone from the family. But if the family is here, we just explain the situation to him. Okay. Any other question?
تمام شكرا.
Okay.
Yes. في أي حاجة جابتها من بره السيناريو؟ في أي حاجة هتبقى إجابتها من بره السيناريو، يعني زي مثلا إن هو عمل فاست أو عمل CT؟
No,
يعني أنا عارف إن عمره ما حد هيدخل رابشر سبلين ويعمل له سبلينكتومي إلا لما يكون عمل فاست، لكن هل ده لو ما اتذكرش في السيناريو؟
even is not mentioned, so of course it is done.
أوكي، يعني في حاجات كده بس نتجه يعني.
Yeah, usually it is mentioned the ultrasound is done or something done, so usually written. But suppose it's not written, so if it's not written, he don't ask you.
Okay.
Okay. All right. Any question? So we start, Dr. Zahra. You need to.
أنا محمد راجب
make it. All right. Okay.
لا
دكتور محمد.
انا زهرة اللي خلصت دكتور
All right.
رجب.
You are welcome.
أنا مستعد أخذ الثانية.
All right. Okay. So the second is also common and have a lot of debate.
Yes.
Okay. All right. So I can read it to you.
Yes.
I just share. Okay.
You want to start, Dr. Ahmed, or I will start?
All right. Okay. No problem.
As you want, Dr. Zahra.
ده رجب يا جماعة، أنا زهرة خلصت خلاص.
خلاص محمد يبدأ.
All right. Okay. So I just read it. It is the same. So Mr. Gray wife came today to meet the consultant, Mr. Mann, to discuss her husband's case diagnosed as malignant ascites. The patient just admitted 2 days ago. Only done is a basic blood investigation and aspirated cytology, 5-needle aspirated cytology from ascitic fluid. He's not smoker, not drink alcohol, or drink alcohol occasionally. One of the staff told him yesterday that he had advanced cancer and incurable and in the late stage, and he will take palliative surgery. CT is not working today. You will take few days to be fixed. The patient brother live in Australia and just have a coronary bypass few months ago. You are CT. CT mean core training or junior doctor came in behalf of the consultant, Mr. Mann, as he has an emergency operation, abdominal aortic aneurysm. Okay? So just read your notes. By the way, his brother, he did the operation few months ago because someone sent it to me. It is 2 weeks or something in the YouTube before. Okay, so you can start.
Okay.
Of course, the patient is angry also. She is angry. She is looking angry when she speaks to you. Okay, you can start.
Okay. Good evening.
Yes, good evening.
I am Dr. Ahmed Kouda from the surgical department.
All right, so I don't need you. I need Mr. Mann. Where is Mr. Mann?
I really apologize for you. Mr. Mann has to go for operation for an emergency surgery.
But yes, this is our case also is emergency. My husband is emergency case. They say they have advanced cancer. So it is also emergency and we are in bad situation.
I understand your concern, and
What you mean by emergency case? How emergency is this? What you mean by that?
the patient that he's in the operating theater with Mr. Mann had a rupture aorta, and you know the rupture aorta is
Yeah,
the
you
main
mean
artery.
big artery in the abdomen. Okay,
Yes,
okay, I
yes.
understand. All right,
And
okay.
if we did not intervene as soon as possible, the patient will die.
All
So
right, okay, all right, okay.
yes,
So, doctor, are you sure that my husband has advanced cancer?
unfortunately, yes,
So
he
how
has.
to know have advanced cancer in one test? Is this test sure or we need to repeat the test?
No, we don't need to repeat the test because he is already having fluid inside his abdomen, which is called ascites, and also was proven with a needle and with examination under microscope that these are malignant cells, and usually this picture.
No, doctor, speak slowly, slowly.
Yes.
Just I need to confirm. Is this this like, for example, sure test or not?
It is a sure test if it is if it showed if it showed cancer cells, but we don't know the source.
Yeah, so it is sure test. We don't need to no false or no false result or something like that.
Yes, exactly.
All right. Okay. So, what does cancer come from?
Actually, we are not sure about the cancer, the primary cancer, but we are sure that this is a spread of the cancer, and this is why your husband has fluid inside his abdomen and proven with the.
Are you sure no definite cure?
Unfortunately, yes, because it is very late cancer, and we are going to give him medications to alleviate his symptoms and improve his quality of life.
Okay, but he have what we called it dyspnea or shortening of breath. What shall we do?
I understand your concern. We can do we can. I believe this shortness of breath is coming because he has a very distended abdomen due to the fluids inside his abdomen. So we are going to alleviate his symptoms by decreasing these fluids through a needle.
Doctor, you
Yes.
speak a lot. So how to relieve this obstruction?
With what we call a paracentesis, abdominal paracentesis, by draining
Okay,
these
so
fluids
just
from the
drainage the amount. So just speak in
Yes.
simple way. So you
Yes.
just drainage the amount.
Yes.
Okay. All right. Okay. So okay.
Okay.
Okay. So I just looking for the question.
Yes.
All right. So who will treat him later?
The responsible for this will be the what we called the intern doctor with the oncology doctor.
You mean the
Oncology
oncology or palliative surgery? I agree
palliative
with
surgery.
you.
Yes. Yes.
Okay. So shall I call his brother to come to Australia?
I think yes. You should call him if he want to take a look over his
All right.
brother.
So I think it's better to tell him, just explain to him, but he need to take a decision from his
His own.
open.
His own. Yes.
All right. Doctor, I think that you are, I hear that the CT is not working. So
Yes.
how to solve this problem?
Well, it will be as I've been told and informed that it will take a few days to repair it. At the same time, it is not an emergency CT to do, and it will not change our plan.
So we can transfer him to any other hospital or something like that?
Currently, there is no need. We can just wait for the scheduled appointment for the CT.
All right. Okay, can you summarize?
Yes, to summarize for you, Mrs. Gray, your husband unfortunately was diagnosed with advanced cancer, and this was proved with the cytology, which is called microscopic examination, by draining fluid from his abdomen, and he is going to be a candidate for a palliative treatment, which means to drugs including chemotherapy, and to improve his quality of life. Do you have any questions, ma'am?
Okay. All right. Thank you. All
Thank you
right.
very
So
much.
it is easy now, as we mentioned before. So it is
دكتور شيرين،
yes.
معلش انا اسف من المقاطعه، بس انا
You
امتحان
can
يوم
ask.
الجمعه امتحان يوم الجمعه اللي جاي،
Okay.
فكده المستوى كويس accepted ولا؟
لا، أهم حاجة you need to be not exhausted at time of exam. If you are exhausted, this is not good.
لا يعني كبرفورمانس كان كويس.
Exhausted. Yes, it's okay. But
Thank
you don't need to be exhausted. If you are exhausted at any time in exam, it is not good.
Thank you.
Okay. All right. Good luck. Good luck in exam, by the way.
Thank you.
Okay.
Thank you very much.
All right.
انا السبت يا دكتور شيرين، يلا اخد بقى اللي بعدها على طول.
All right. You can, no problem. Okay.
ممكن اخد اللي بعدها انا بقى.
All right. Okay. You can arrange. So the next one is about splenic haematoma. All right. So we can start. Okay. I just we found someone is called the Siwi or something. He need to enter, but we try to give him the link. I try again. Just give me a second. We try to send him a link. Okay. So I just read it. So first is 32 years old. You see the screen or not now?
Oh yes, I can see.
Okay. Okay. So is 32 years old, traveled to attend the rugby match. Back from his trip, he had a car accident. Left side of upper abdomen and the lower chest very painful. He take a deep breath. After ABCD evaluation for ATLS, chest X-ray, fast scan, show fracture left 9, 10, 11 reps, left side, splenic hematoma. The patient admitted under observation in surgical ward. The patient insisted to leave the hospital in the evening, and he will important interview tomorrow morning and can affect his job career. You are Dr. Richard, the ward nurse. Call me.
Okay.
Okay, just give me a second just to
Okay.
admit this. Someone need to be admitted. Okay. Okay. I just need to edit. Okay. Okay, I think we can start. After that, we can see who's not coming. Okay, can we start? Yes.
Yeah, good afternoon. My name is Dr. Richard, one of surgical doctor on the duty today. Could I confirm your name, HPZ, please?
Yes, I am Charles. I am.
Nice to meet you.
Okay. All right. Okay. Good.
Nice to meet you, Mr. Charles. Today I have been told you have some concerns regarding your admission to the hospital. I'm here to discuss this concern with you today. Is it okay with you?
Yes, can. No problem.
Thank you, Mr. Charles. So what is your concerns regarding your admission to the...
I am here in the hospital, nothing to be done for me. And tomorrow I have a very important appointment, can affect my career. So I need to promote it in my job.
Our congratulations for that appointment. I hope you will be accepted for this appointment and improve your job. That's first. The second thing, you are admitted to the hospital these days because you have injury to your spleen.
So what is spleen, doctor? What is the spleen?
Yes, I can tell you everything about spleen. Spleen and organ lies inside our abdomen or left side, upper left side of the abdomen.
Yes.
And it's variable. It's vulnerable to any minor injuries. After injury, while you are playing rugby.
So why is the cause of this injury?
Yes, because you have fracture to ribs, 9th, 8th, 11th.
9, 10, 11th, yes. Yes.
Yes, 9, 10, 11th rib injured and affected that spleen. It's very vulnerable to any minor injuries.
Yes.
So that spleen have what's called the hematoma, which is mean collection of some bloods beneath the capsule of that spleen. And causing internal bleeding.
No, there's no internal bleeding, doctor, relax. So you mentioned that I have splenic haematoma, but nothing to be done to me. It's just to give me painkiller so I can take it at my home.
Yes, I understand and appreciate your concerns, but your being in the hospital right now is for observation and look for your blood tests, check hemoglobin level inside your blood.
So what is the value of that? Doctor, relax. What is the value of that?
Yes, the exact value of checking hemoglobin daily is to know if there any drop in your hemoglobin. It means the ongoing bleeding, and it's critical situation in such your situation.
So if this happened, what shall I do, or what you will do for me?
If it happened inside the hospital, we will give you some medication to stop bleeding. And if all trials failed, we will take you into theater directly.
No, doctor, just confirm with me. If I have splenic hematoma and this hematoma rupture and I have bleeding, so what this called, this condition, what we called it?
It's called the internal hemorrhage.
Internal hemorrhage. So if this have internal hemorrhage, you can give medication to stop that, or you need exploration?
No, directly go to theater to explore your...
All right. So we don't just, you have what you say now is just fatal mistake. We don't have something to stop bleeding. If they have injury of a spleen, so you must open and remove the spleen.
Yes, right.
All right. Okay.
All right.
All right. So is any solution for my appointment tomorrow? Any suggestion from you?
Of course, we can call your employer, and if any chance to schedule this meeting, we will do it. If no, we can
Doctor, what you mean schedule this meeting? What you mean?
Another time after you achieve full recovery.
So it can't postpone, but he's insisted. He said no. What is?
I can arrange a video call for you with the employer if it available. We can do it for you.
Okay, suppose he refuses, what shall I do?
If he refused, I will. If he insisted to discharge himself, I will.
No, I not insisted, but I just ask you for any solution.
Okay, I can arrange. We can arrange an ambulance for you. You can go for the meeting and back to the hospital again.
All right, this is a good idea. I think I do that. So we have many options. You can arrange online meeting. You can postpone the meeting. You can send him by ambulance and send him back. So all these options can be accepted. Okay?
Okay.
All right. I just have another one. He tried to enter. I just arrange for this. Just a minute. Whose will be the next?
Now.
All right. Okay. So well done. I think your exam is just a few days. The last one. What's your name?
Muhammad.
Okay, Muhammad. Okay. So it is important just to be relaxed in exam, so it will be easy. Okay.
Any other advice قبل الامتحان يا دكتور شريف؟
No, you must be relaxed. If you are in stress at any time of exam, you will be in trouble. So don't be in trouble.
اوكي شكرا دكتور شريف.
All right. So
إن شاء الله.
don't be in stress. Okay.
Okay.
It is important, again, the patient who is standing, he don't sit down except you tell him something. It is impossible to see your son. It is in theater. Even me not allowed to enter because we need to change our clothes and you don't enter the theater. By the way, I just for the patient with his mother, usually the mother ask you, where I can waiting, doctor? So usually she is waiting not in recovery room, of course. She is waiting in waiting area in front of the operative theater, not in emergency, not in the recovery room, just to avoid misunderstanding or miss something during this. I hope that who's in waiting, they enter. Sorry, I think they have some in your computer, not in ours system, but we can see. All right. So after that, we have another scenario, which is postpone any procedure which is common, whatever the procedure. It can be arthroscope, it can be something, so it must be something not urgent. Of course, simple, so simple, and is not urgent. Okay? So we can start now. So this is any procedure, can be simple operation like lipoma, can be arthroscope, can be anything. So suppose the patient, usually she is an angry patient. Okay, and again, it is an actor. I just share the screen. So it is, you see the screen or not, by the way?
Yes, we see it.
Okay, so a 45 years old woman, obese, working in supermarket, and had a tear in one of the right cruciate ligament in the right leg. She took many painkillers that cause gastritis. She had appointment today for arthroscope with Mr. Arthur, who is called for an urgent compound fracture with vascular injury. You are Richard, orthopedic SHO. Mr. Arthur is a consultant. Ask you to explain the matter to the lady. So it is important, usually, if the consultant not come, it means that they have urgent operation, and this operation is life-saving, because you know that in orthopedics they don't have much life-saving operation. But if the patient have fracture and trauma or vascular injury, so we need the vascular surgeon as soon as possible, and also the orthopedics to work together. So this is why, because the patient can say to you, as far as I know, in orthopedics, they can wait, the fracture can wait 1 day, 2 days, no problem. Okay?
Okay.
So you can start.
Abtedi?
Yes, can.
Okay. Good evening.
Yes.
I'm Dr. Richard from the surgical ward.
From orthopedic.
For the orthopedic ward.
Oh,
Can
yes.
I confirm your agent name, please?
Yes, I am Anne Mary. I am 45 years old.
Welcome, Mrs. Anne. Can I call you Anne?
Yeah, can, no problem. But I don't read you. I read Mr. Arthur. Where is Mr. Arthur?
I really apologize for you, Mrs. Anne.
Why he's not come? He not respect me or what?
No, of course, we respect you the most, but unfortunately...
Yeah, you don't respect me because I am normal lady, not rich woman or something like that, or what?
No, you are of course very valuable for us, and you are very important.
Very important. Okay.
Yes.
All right.
But
all right. So why he's not coming?
Unfortunately, we had a patient in the orthopedic department who has a fracture.
No, I know my father. You know, my father many years ago have fractured femur, and he wait till the doctor fix the fracture 2 days. They put in something called Thomas splint, and he wait for 2 days, and nothing happened. So I know that in orthopedics you don't have much emergency.
Yes, I understand that, but unfortunately, this fracture is different. It's a different situation because we have a vascular injury, which is.
What you mean by vascular injury? You mean that artery or something like that?
Yes, there is an
All right.
artery that is with ongoing bleeding and need to be fixed as soon as possible. We cannot leave the patient with bleeding.
All right, but I think Dr. What's called the Dr. Arsar is difficult to fix the vascular injury. He's
Say it again.
not a vascular surgeon.
He will
He will
he's
be
not.
the team for vascular. You mean that he assists the vascular surgeon, he fixes the bone, and the vascular repairs the artery. This is what
Yes.
you mean. Okay,
Yes.
all right, okay. I know because I know that I have some experience in medicine because my neighbor is work as a nurse. So I know that what is the difference between vascular and orthopedic. All
Excellent.
right. All right, thank you. So, what is now I take a leave, and you know that is the supermarket manager is a very rough man, and he gave me just 1 week. So, what shall I tell him?
We will write for you a report of what happened, and you can, according to this report, take a sick leave. If
No,
it
I
is
don't need a sick leave because I come again and need a holiday after that. So I can cancel my leave now. I back to the supermarket. But what shall I tell him?
we will reschedule you and we will give you the next appointment.
Who will
And
contact me?
well, the secretary of the department.
So what's the time you have? You give me a time and date. What time?
Actually, it is. I'm not authorized
Yes,
to,
but just tell as soon as possible or the nearest
Yes.
appointment.
Yes,
Okay.
I will do my best.
Don't read to get rid from the responsibility, doctor. Just tell her I will ask the secretary they give me appointment as soon as possible. And also give me a letter. You can see here, so the secretary will call you as soon as possible to give you another date. All right. So just to give me any advice, and also I take a medication. This medication causes gastritis. So can you give me the medication again?
I'm sorry for the gastritis. No, I cannot give you the medications again, but we can use another topical medications that will relieve your pain.
What you mean by topical like cream and other? Any advice to me till I have the surgery?
Yes, it is important to get some rest, and also you can do some sport or swimming or visit the physiotherapy clinic for
Okay, just one
relieving
by
the pain.
one. So you ask me to do swimming, go to physiotherapy, okay, and of course because I am overweight, so you can advise me also because reduce the weight.
Yes.
Okay. And of course, it is good answer that I don't give you medication because some students say we will give you better medication. So don't cause gastritis, so the patient is angry and say, so if it is have a good medication, what you don't give me from the start? You
Yes.
understand?
We
Okay.
want to get we want to get out of the trouble of asking why you give me medication.
All right,
that
yes,
is,
okay, it's a good idea because if you tell her I give you some medication not cause gastritis, so doctor, why you don't give me at the start? So it is supposed to give her non-steroid anti-inflammatory coated form from the start, so we don't have any other option. Okay.
Yes. Yes.
All right. Thank you.
معلش يا دكتور كريم، كنت عايز اقول
Yes.
لحضرتك بس ان في كميه ناس في الميتنج مكتوب جواهم انفيريفايد، دول زمايلنا في الجروب مش عارفين يدخلوا برضه.
انا اعتقد ان هم دخلوا. انا بعت انفيتيشن لحد لدكتوره اسمها دكتور ساره عند دكتور سوي او سواسي.
سويسي، انا فندم سويسي، انا
سويسي.
دخلت خلاص اوريدي.
and Sarah I think is here and Lina I think is here. This is the who is contacting me.
يا فندم هو مكتوب جنب الصوره انفيريفايد، فهو في الغالب هم مش عارفين، يعني لازم حضرتك تعمل اكسبت من جوه.
ما هو انا ما عنديش يعني هو كله انا ما فيش حد not accepted. I will try بس ما فيش حد not present. عشير
هو تقريبا كله دخل يا دكتور شيرين، تقريبا كله دخل. هو انفيريفايد ملهاش علاقه يعني مين طيب دكتور سويسي اللي ما دخلش اسمه؟
بص، هو
يعني
في دكتوره اسمها دكتوره لينا ودكتوره اسمها دكتوره سوره، الاثنين دول برضو نفس الموضوع. هو بيجي لنا شاشه
دخلوا
كده
هم اوريدي موجودين.
أنا موجودة.
موجودة.
طيب
اوكي.
تمام،
I
خلاص
don't
اوكي
know
اوكي
what.
عشان
All
هم
right. You are welcome.
تمام ماشي اوكي.
Okay.
In
All right.
such situation of medication, could I tell him I will give you some medication to protect your stomach or abdomen from the effect of analgesia، ولا دي برضه تبقى نفس المشكلة بتاعت الميديكيشن؟
Usually when we give a medication, you give a coated form like G aspirin or something, or you give her a medication with proton pump inhibitor from the beginning. Okay. But you can tell, I just check if the doctor who gives the medication last time, he give you something like proton pump inhibitor. If you don't give, I will add it to other medication. Or you can say, okay, it is better to use local cream or local analgesic or something like that. Okay, but don't say I give you better medication. You can skip this area, but just say I can give you I check that you have proton pump inhibitor or not. Okay. Dr. Swissy, you need to ask something.
انا كنت عايز اشارك بس كنت عايز أشارك.
Okay. All right. Okay. All right. So this is about whatever the cause of postpone. It is important in the beginning just to explain the patient that is the doctor in something actually urgent, like have a vascular injury, abdominal aortic aneurysm, in simple ways, that big artery in the abdomen, the artery in the vein, or the artery in the lower limb. And also you can explain here, she is not the vascular surgeon, she is the orthopedic, but they need him because after the vascular reconstruction, so he need the orthopedic to fix the bone. Okay, so just it is like something technical. This is easy station. They take about 3 minutes, and you have nothing to do else. So just relax. Some station, it is like not all station is hard station. So in this station, you take maximum 3-4 minutes. So just relax, sit down. The examiner not to speak to you. Don't speak to anyone. Just relax. Okay, so all the stations, we have 17 stations, we have 2 preparation stations, we have 3 rest stations, so the total is 22 stations, 22 times 10, so 220 minutes, so it is about more than 3 hours and a half, or about 3 hours and a half, so it is a long time. So at the end, you become exhausted. So this is why you can find, apart from this station, some station is very easy, like this station. Okay. By the way, we don't have, because some ask me, we don't have failure in the station. We have a mark. This is exam have no how many station you pass, how many station to fail. If you make it like this, no one pass. So it is a number. They collect the knowledge, they collect the clinical and the procedure skill. The knowledge is out. It is what is called 332. It is 8 stations, so it is out of 160, and the other is 9 station is out of 180. So 160, 180. So the total is 340. The pass mark is variable from exam to exam. The last exam is about 230, 240, sometimes to 220. So it's different from time to time. Okay. It is important in exam to be relaxed, don't be in stress, don't be exhausted, don't be appear so tired. So it is important to sleep well from today. Don't stay long. It is important if you come away or far away from the Maadi hospital, which is the exam held. So it is important to stay beside it or to come so early to avoid traffic jam. By the way, if you don't know the venue, it is not in the main building of Maadi Hospital. It is in the liver and the kidney transplantation, which in the posterior is not the River Nile area. It is related to the underground area. Okay. So what is else we have is
معلومة مهمة جدا والله يا دكتور. أنا كنت فاكر مستشفى المعادي.
No, it is not in Maadi Hospital. It is in the مستشفى زرع الكبد والكلى. It is in the same big Maadi is
ما
a
هي
very
نفس
big
المكان يا
hospital.
دكتور سليم، بس ورا المستشفى، بس هي نفس المكان.
Yes, ورا المستشفى. ورا المستشفى.
besides the main hospital, yes.
Yes, it is inside, but it is better to go to have a separate road. يعني لها طريق منفصل.
Okay.
Okay, so it's just information giving, or in the information giving, one station is to consent to the patient, and this patient is confused. Again, to avoid the debate of the what's called the many mental status and all this, if we don't mention do many mental status, so you can do anything. Okay, so in this scenario, this is 75. I can share or not share? I just
Please share again.
share again. Okay, all right. So it is 75 years old woman admit to hospital for redo elective total hip replacement, as he had an operation done 15 years ago. You are CT. CT mean court training. Court training is like houseman or internship in some country. So it is like junior doctor or young doctor asked by senior staff to consent the patient or take consent from the patient. You are Dr. Gandhi, CSHO in orthopedic, and you found the patient confused. Okay, if you see this script, we don't ask you to do any mental state or something. So it is just you can chat with the patient. If you chat with the patient, can be through any score you need, any mental state or whatever is something. But at least it is important not to concentrate on this and avoid and forget to ask about other disease. So this patient can be hypoglycemic, can be diabetic, you don't take a medication. So you need to ask about systematic disease, you need to ask about a stroke, you need to ask about history. So you can consider is like proper consent and some history taken. It is important to know this is elective operation is total hip replacement. So it means that you remove the hip and put another hip. It is not a fracture hip. So it is just so it is not urgent. And so who need to start? Anyone? I think. Okay, you can. What's your name?
Muhammad.
Mohanad. Okay. All right. So you can start. After that, we take Dr. Ragab. All right. So this patient, of course, the idea is either preoperative confusion, consent or capacity for consent. All these are the same. The simple way is orientation to time, person, and place. So you can start. I am the patient. Hello.
Hello, I'm Dr. Muhammad. I'm one of the exam candidates today. May I confirm your
Yes.
name?
Yeah, I am Anne Mary. I am 75 years old.
Hello, Miss Mary.
Yes.
I know that you came today for your preoperative assessment.
Yes.
Can you tell me which your complaint or which hip you have the pain?
It is right hip.
Okay. And how can you rate your pain out of 10?
No, it is not history taken, doctor. It is not history taken station. It is preoperative. How to take a consent. So how to take a consent? They need to. If you see the task here, the doctor ask to consent the patient. He just take a consent.
Okay. Nice.
Okay, so I know that I have total redo. I did the total hip replacement. I have no pain. I did the total hip replacement 15 years ago. I think is another doctor. He died now, and now I need to do it again because they say they have some problem in the this metallic joint.
Okay. First, can I ask you some question to just assess your memory?
Okay, can.
What is the date of the day today?
Today is Sunday.
And what is the date?
It is 6th of July.
Okay. And where are we now?
We are in hospital.
Okay. And what I'm working?
I don't know. Okay.
Okay. Thank you. Do you take any medications, or do you have any chronic medical condition like diabetes or hypertension?
Yes, I have hypertension and I have diabetes.
And what do you take for it?
For hypertension, I take Brondopil, is AC inhibitor, and for my diabetes, I take metformin, but I forget to take it for many time. And also, it is not controlled. Doctor asked me to take insulin, but I am afraid from injections, so I don't take insulin.
Okay. And have you been admitted to hospital before?
Yeah, I admitted, of course, because this operation. I admitted also I have a mild stroke before, so I admitted many times.
I'm sorry for that.
Mm.
When the last time you have admitted to the hospital?
No, I forget.
Okay. And have you had any previous surgery apart from your hip replacement?
No, I forget also. Of course, as a patient, you ask correct, but the patient usually he tell you she's have some loss of memory and all this. So at the end, you say it is not fit for to sign a consent. Okay, go on.
Okay. Do you have any allergy to drug or food?
Yeah, I'm allergic to seafood.
Okay. Do you take any blood thinner?
Doctor advised me to take aspirin, but I don't take it.
For what he prescribed?
Because I have all the stroke.
All the stroke. I'm really sorry for that. And can you tell me whom do you live with?
I live with my daughter and her husband.
Okay.
I forget the address of my home, by the way. You can ask about the address, I forget it.
Okay. And do you smoke or drink alcohol?
Yeah, I smoke 5 cigarettes per day for the last for long time, and also drink alcohol occasionally in the celebration or any party.
And are you normally independent?
What you mean?
As you are doing your
daily activity, you mean? No, I think it's difficult because I am old woman, so maybe I need a help. So this is why I live with my daughter.
Okay, I'm sorry for that. And do you have any shortness of breath or chest pain?
Yes, sometimes I have shortening of breath, and doctors say I have hypoxia.
Okay, and did you do any investigation regarding
No, it is okay. I did the investigation, so it's okay. It's just aging process.
Okay. Do you have any difficulty in swallowing?
No.
Have you lost weight unintentionally?
No.
Okay. Do you have any problem with urination?
No.
Okay. Do you have any problem with your kidney?
What you mean by no? No, urinary system is okay. All right. So, doctor, okay, we finish. So, of course, when you start, of course, you ask about name, you ask about how old or date of birth, you ask about time, you forget to ask about address or year. It is important also to recognize doctor or nurse, what time you are morning, afternoon. So they usually the patient tell you something and forget something. You can ask about the address, and it is important don't to forget to ask about loss of weight, loss of appetite. It is important don't to forget to ask about diabetes, hypertension, dyslipidemia. So at the end, this patient maybe have some problem. So it is, what is your opinion? It is has a capacity to sign the consent or not?
No, because he can't make an informed decision and he can't retain the information.
All right. Okay. So, all right. And what is your decision to postpone the operation or not?
It is better to postpone the operation until the
yes, because this is operation is not non-urgent. It is not urgent operation. So this patient is confused. What you expect? What is the cause of this confusion from your point of view?
Maybe because of the hypoxia and
can be hypoxia. What else?
And the hypoglycemia.
Can be hypoglycemia. Okay. Can be infection, you need to ask about fever. Can be due to
Yeah.
head injury, we need to do CT scan for her. Can be due to some medication or she take medication. So what is your advice? Who will take care for her? Like which specialty can manage this patient till we do the operation? What is your
Uh,
advice
the
as a doctor?
psychiatry
Not
department.
psychiatry, not psychiatry doctor. It is the medical team. So it's better to send her to the medical team or internal medicine team just to control his diabetes, to control looking for hypoxia, so evaluate the patient, and we can see what happened to the patient. Okay, so what happened, of course, the investigation can be including CT, blood gases, urine analysis, kidney function, all this. And it's managed by medical registrar. Don't forget to ask for chest X-ray, CT. So what is the problem of this station? Usually the student concentrate on the how to take many mental state, but actually from if you do that alone in proper way, you don't have time to ask about the medical problem like diabetes, hypertension, hypoxia, which is very important to us. So it is important if we don't mention in the scenario do many mental state, it is just in simple way you ask about orientation to time, person, and place. You ask about what's your name, what is how old are you, where you live. You can ask a simple question like where are you now? We are in hospital. Who's me? You are a doctor. This is a nurse. So just ask, maybe ask some like what is the president or what is the king or something like that, any general knowledge. But don't stop here. You need to ask about diabetes, hypertension, hypoxia, chest infection, previous stroke. And of course, the treatment is done by you refer here to internal medicine or medical department till the patient improved or the patient become more oriented. In old people, the common cause of confusion, pre or post-operative, either electrolyte disturbance or hypoglycemia, or sometimes mild trauma, especially if the patient have subdural hemorrhage. So if the patient have subdural or something due to mild trauma can be the cause. Okay. Anyone need to ask about this scenario?
Because I'm just gonna give a theoretical scenario. If the patient is confused and she cannot
Yes.
tell me any information, so will I ask for the relative or somebody else in the room? I don't know if that happened before or not.
No, it can. No, I tell you, what happened is the student himself, he becomes so clever and saying, I don't ask the patient because the patient is confused, so I don't complete the history. And this is wrong because we know that it is not a real patient. And of course, the patient, if you ask about like person, what is the date, what happened, she tell, I don't know, I don't know, I don't know, I confused. But when you ask her about diabetes or hypertension, he speak fluent because she knows that this is important to ask. Okay,
Okay.
so don't be volunteer. I don't ask her about the other medical because I found she's confused. Okay, of course, in exam we don't have a relative, but so we don't have the relative of the patient. But suppose in the real life you have the relative of the patient, of course, you can ask, but usually in UK and in big hospital in Egypt or some country, the patient data is in the computer of the hospital. Because you know that in each city or small cities, they have a hospital and the GP both have the data of the patient. So if you just go to the computer, you can find the patient data. But for exam, it is important just to ask here. So don't forget, don't say I don't ask here about chronic disease because the patient is confused.
Okay.
Okay, it is the easy way to have to lost mark in this station. It is very happened. It's very common. Most of the students say, "I don't ask her because I found her is confused." Even if you ask and she not responds, it is good. But usually she responds to you.
Okay.
Dr. Ragab, you need to share or you need to ask something.
No, to share on.
All right. Okay. So the next we have consent for appendectomy. So the consent for any operation, and usually it is either the mother or the patient himself. He refused to sign the consent. He say, I don't need to do this operation. So whatever the scenario, can be gallbladder, can be appendix, whatever. So like this scenario, 15 years old girl complain of pain in the lower abdomen, brought to the hospital by friend, diagnosed as acute appendicitis. She waiting her mother to sign a consent. Her mother refused to sign. You are Dr. Richard, SHO surgical. Okay?
Okay.
All right. So we can start, Dr. Muhammad Ragab.
Okay, good afternoon. My name is Dr. Richard, as SHO, working in the surgical department on duty today. Could I confirm I'm talking to, please?
Yes, I am the mother. I just my daughter here, Sarah, and I found she is prepare her for a theater. I refuse to sign the consent.
Yes, of course. I'm here today to discuss with you your concerns about this consent. Could you explain for me your concerns about that consent, please?
No, because I think I Google, I found that this acute appendicitis can be treated by antibiotic. So why you need to operate it on her?
Yes, I understand your suggestion about this information. Actually, your daughter brought to the hospital today with tummy or acute abdominal pain. Our initial scans reveal that she has acute appendicitis, and in such situation, we should go and remove the appendix because
Doctor, is acute appendicitis is inflammation.
yes, inflammation to appendix.
So in inflammations, you can give antibiotic. If you have tonsillitis, you can give antibiotic. So why you need to be operated?
Yes, of course. But in such inflammation of appendix, it has a less fat in her abdomen and make it vulnerable to be perforated or cut through, and this critical condition. So we should go.
Why is critical? Is the patient can die from this small organ called appendix?
Unfortunately, if it perforated, it might reach to die.
How it comes?
Comes from sepsis, from infection.
All right. So you mean that if the patient have appendix and this appendix is perforated, so the content of appendix come to the cavity of the abdomen, we call it peritoneum, and cause inflammation of this cavity, and they can complicate it by what we call it a septic shock, which is fever, blood pressure is drop, and pulse or heart rate become increase, and this is fetal condition. So this is why you need to operate in my daughter. This is correct?
Yes, correct.
So is any treatment given to her?
Yes, we put a cannula into her veins or to her, and we give through it intravenous fluids and antibiotic and medication to relieve the symptoms until preparation for surgery.
All right. So just tell me, doctor, what is appendix?
Appendix is an tube lies inside the right lower part of the abdomen. This tube sometimes closed by particle of food, by feces, and cause serious cycles of inflammation.
All right. So if I sign the consent, so can you just tell me what is the step of operation or what is this operation?
Yes. First of all, we will clean the wound and.
No, I don't ask. I don't help you. I just ask. For example, if she is wake up during operation and help you, or you put her to sleep.
Yes, we will put your daughter in sleep by anesthetist, and after that we will.
You mean she take general anesthesia or local?
No, general anesthesia.
All right. So what is the technique you remove the appendix?
Yes, it's okay. Hole open into her tummy or to her skin of her abdomen.
How many hole usually?
Usually 3.
So you make 3. You give general anesthesia 3 hole, and what else you need to tell me?
If something happens inside the operation and the surgeon needs to extend the wound, we will open more in her skin and
all right. So you
and
mean that in not all the cases is successed by laparoscopic surgery or keyhole surgery? So sometimes we
Yes.
need to convert it to
Convert into
open surgery or traditional surgery. Okay. How? Okay.
Yes.
So if suppose it is laparoscopic, how long she stay after that
3
in
days in the
hospital?
hospital after.
Okay.
Yes,
So is
3
any
days.
any complication can happen after we discharge here?
No surgical operation without complication. This complication start from fever and infection and up to inflammation to the whole abdominal cavity.
No,
But
doctor,
patient
relax. We just tell the simple way. So like you can have wound infection, you can have discharge, you can have fever, because the complication of the wound is important to patient. Okay. So if this happened, what shall I do?
just contact your GP or come back to the hospital directly.
Okay, so come even in weekend or evening, I can come. All right. So I see if you have a stitch for the wound or no stitch.
Actually, we will do stitch for the wound and no
So
need to
where and when I remove the stitch? Where and when?
Yeah, you can visit your nearby GP clinic and remove it by nurse or doctor in GP.
When?
Yes, after 10 days from operation.
All right, thank you. So after that, you summarize. So what you need to tell first, we start by explain to the patient what you know about her daughter. So she know nothing. She just have a phone call and she say the friend say it is in the hospital. After that, they ask you what the treatment they're giving. So can put a cannula, intravenous fluid, antibiotic, and the patient is fasting for operation. Why the patient or the mother refused to be signed the consent? Because she read in the internet that can improve by antibiotic. Of course, nowadays you have a lot of trial or study compare between antibiotic treatment and surgery, but forget that. After that, you explain the patient what is appendix is the organ in the right side from the gastrointestinal system, and in the appendix is in sometimes not improve with antibiotic and can perforate it and cause inflammation in the cavity lining in the abdomen. We call it peritoneum, and they can cause inflammation, which you called it peritonitis, and in some cases complicated by what we called it septic shock. So it is fever, blood pressure drop, and the pulse rate or heart rate become increased, and this serious condition. And of course, you explain the patient about procedures. You start by anesthesia. We give her general anesthesia. We start by keyhole or laparoscopic surgery by 3 holes, each one from 1/2 to 1 centimeter. But sometimes due to difficult anatomy or some variation, we can change it to traditional open surgery. We don't extend the wound. It is different wound. How long you stay in hospital? If laparoscopic, maximum 2 days, and you remove the stitch after 7 to 10 days in the nearby GP or general practitioner or nearby small hospital or clinic. Complication of the operation is mainly wound infection and the discharge or fever. How to contact the hospital? So you give here the contact number or hotline for the hospital. I think, doctor, no need to tell her no surgery without complication, except if the patient is say how it come. So you just tell her no surgery without complication, but it's okay.
ماشي تمام. Any
After
other
that,
advice?
no, it's okay. It's just
دكتور معلش،
simple. Yes.
هي الحته بتاع الانتي بايوتكس دي برد عليها، بس ان هي ممكن يحصل لو انا ما عملتلهاش ابنسكتومي ممكن يحصل برفوريشن وبرتونيتس، صح كده ولا؟
Yes, because of course, it is logic. Because even nowadays, some doctors use the policy we can give antibiotic instead of surgery, and they have a lot of research and the study even in many countries about this. they compare this to this. But actually, we don't know what is the response. Maybe not improved, maybe perforated, and even perforation maybe cause adhesive later. Maybe I see the patient 10 years, 20 years have adhesive intestinal obstruction due to inflammation after appendix or hysterectomy or whatever. So it is better to remove appendix as early as possible to avoid complication, to avoid peritonitis. Okay. I found, thank you, a lot of hand. So
انا ممكن اخد دي يا دكتور شيرين لو ما
okay.
حدش.
All right. So anyone, I think, what's your name? Who speak? Is Ragab?
زهرة محمود زهرة.
Mahmoud Zahra. Dr. Ragab, you elevate your hand. You need to ask something.
I
Dr.
just finished my. If
All right.
anyone will take this,
Abu
I can take
Feda, Dr. Ahmed Abu Fouda. What you need?
يس انا كنت حابب اشارك بس خلاص دكتور
All right.
محمود.
No, خلاص هنبتدي بيك يا دكتور احمد مش مشكله. دكتور محمود, I
أنا؟
think you shared before. You shared
Okay.
before, I think. Okay.
Just
So
before I can share Dr. Sheen.
all right. Dr. Abu Fida, this is the last. It is easy, but it is
Fouda.
actually. You see the screen, or I need to share?
Yes, I can see it.
Okay, it's 55 years old man, chronic smoker, complaining from frequent attack of heartburn. You are a surgeon in charge to take a consent from him for OGD. OGD means the upper endoscopy, esophagus, gastric duodenum, plus or minus biopsy. You are Dr. Richard SHO in surgery. This is easy station, and you can start.
So good evening.
Yes.
I am Dr. Ahmed Fouda from the surgical department.
Yes.
Can I confirm your age and name, please?
Yes, I am Mr. Richard, and I am 55 years old.
Welcome, Mr. Richard. Today I was asked to take from you a consent form, which is an agreement form for doing the next operation, which is...
Not it is operation, it is upper endoscopy, doctor.
Yes. For your upper endoscopy.
Yes.
Is that okay with you?
Yes, okay. What do you mean by upper endoscopy, doctor?
So it is an instrument. It's like a camera in a tube that we will insert it and intrude it throughout your mouth after making your oropharynx or your mouth numb, and we will give you like numbing agent.
No, we can ask you about the step, but this is
yes.
to see you need to see my esophagus and stomach and duodenum. Can you tell me about the step of procedure?
Okay, the steps that you will come at the day ready for the operation. You will take like a numbing agent throughout your throat.
No,
and
doctor, relax, doctor. In any operation or any procedure, the first thing we mention is position.
Yes.
What is my position?
So it will be a supine position. Mean that you will lie at your left side. At your left side.
No, it is not left side. It is left lateral position.
وانا بقول lateral عادي يعني ولا
lateral؟ ايوه عادي، ما هو اسمه lateral، امال هتسميه ايه؟
يعني
left lateral position. No problem. No, we make it a nurse for you, no problem. Left lateral position. Okay.
In the left
after
lateral
that
position.
Yes.
And after that we will give you through your throat a numbing agent called lidocaine. This is
how to give it to me? It is a spray or what?
It is a spray. Yes, we will. You will be asked to open your mouth, and we will just spray it inside your throat for a couple of minutes, and will start working. At the same time, you will have an IV access to your vessels that we will give you a sedative or a numbing agent that you will feel a little bit drowsy, and you will not remember the operation. So you will be sedated. Then we will put like a plastic instrument inside your mouth that to protect your teeth from.
It is a mouse guard. Put it. Okay.
mouth guard to protect your teeth from any injury. Then we will introduce a tube in a camera called endoscopy. This will introduce throughout your mouth to the esophagus or your food pipe.
Okay, all
And
right. I just need to confirm with you. First, you see endoscopy before or not?
I do it.
All right, okay. So you do it, but you don't remember. So first position, left lateral. You put a cannula. You put nasal prone. You put oxygen to your patient or not?
Of course, oxygen and pulse oximeter.
طب ما انت you forget it. Okay, so I just remember it is important. You know, sometimes if you don't
Yes.
work, but you have position, you put a cannula, you give sedation, give the patient nasal prone, put a pulse oximeter, local spray Xylocaine, introduce the endoscopy, ask the patient to swallow, finish. I just, for medical point of view, as examiner, I ask you, what is sedation you give to the patient?
I will give him a midazolam.
Midazolam. Okay,
Yes.
what is the reverse for it? Because midazolam can work for long time. So what is the reverse?
Flumanazine.
Flamazenil. Just remember, it is like Nil. Or what is it? What is it? Flamazenil is selective antagonist for gamma aminobutyric acid. Okay, so what is the possible finding you can found?
We are looking for a structure which means that stenotic area or mass that we can take a biopsy from.
What is biopsy mean?
Biopsy is taking a sample or a sample from the suspected lesion and to take it out and put it into the container, send it to the pathology to be studied.
Just one by one. So if you have a structure, how to manage?
I will manage the structure first with the balloon dilatation.
Balloon dilatation. And if you have a mass, you take a biopsy. And
Yes.
this is biopsy, you take a sample for examination under microscope.
Yes.
Okay. So sometimes I heard about Barrett esophagus. What is Barrett esophagus?
It is a metaplasia.
What is metaplasia?
It is the change of the type of the tissue. In this condition, it will be changed from the stratified squamous into columnar epithelium.
All right. So what is it dangerous?
At this stage, it is not dangerous.
But can turn to malignant, so need to treat it.
Yes, but if it turn with the dysplasia, this precancerous condition that will be needed to be.
All right. Any complication for endoscopy?
Yes, there is even if it is rare, but bleeding may be the first thing to think about. Also, esophageal perforation.
All right. So if you take a biopsy, when I know the result or how I know the result?
Well, it is expected within 14 days.
No, 14 is too much. 14 too much, but it's okay. All right. And okay. How I know it?
We will schedule an appointment after 14 days. And I will give you the report.
You mean give my appointment in the outpatient clinic?
Yes.
Yes. All right. I just need to ask you the last question. So metaplasia, biopsy. All right. Okay. All right. Okay. So yes, it is important. So I came, you know that I live away from here, so I came by my car. So what shall I do?
If it is far away from your hospital and you're concerned about coming late, so we can...
No. We don't speak about coming late. The patient asks, because if recovery... So what is your suggestion?
You are not allowed to drive the car. It is suggested to come with a relative to bring you home.
My wife can drive, so I bring my wife. So it is important also to explain to the patient if he come by his car, so he needs something to escort him, so he can bring his wife or someone just to give him back to the home. Okay, Dr. Abu Fuda, although it is important, although you did it endoscope, but when you describe, you don't describe in proper way. So it is important to know that you need to imagine what happened in the theater from other point of view.
احنا
So-
عشان حالات دي تحضر من التمريض بيبقى جاهز.
All right, okay.
احنا
So
نخش
what is the
نشتغل على طول.
position? What is the medication? You put diesel prom, you put mouthpiece,
Yeah.
you put all this. So it is important because the aim of exam to know that you are working in surgery or not. Because what happened, they found in some countries, especially Egypt, they have a lot is not working in surgery and apply for surgery. Okay, this is clear. So this
بس هو يا
is
دكتور
first.
عندك سؤال، يعني عندي كم
You
سؤال.
can ask.
هو